All right, good afternoon, everybody. My name is Christina Williams. I am the Supervisor of Health and Nursing Services here at Columbia IU20. I just want to let everybody know that this session is being recorded. I would also ask that if you're joining us remotely, that you put your device on mute so we can't hear you. If you have any questions about this presentation or any questions while we're going through the presentation, I would just ask that you hold until the end. What did you say, Tom? Submit them via chat?
Text chat.
Submit them via text chat, and we'd be happy to get to them at the end of all this. So, what was that?
For the folks that are here, you can hold your questions till the end. You don't have to put them in your text chat. This is for the
We're
folks
requiring you to go on via text chat. So we're coming to the end of our two-day student and school safety conference, and I want to thank my participants who have been here so far and stuck with us, and this is the last session that we're going to do, and we felt that it was pertinent to discuss the coronavirus. Anybody heard of it? No. My joke. So we're going to talk about planning for a pandemic and some of the things that you may be able to take back to your district to do to help in this precedented event. So what is the coronavirus? Anybody in the audience know? I have some nurses here, so you guys are in the popular hot seat, I'm sure. How many of you are really popular with your districts all of a sudden? Yes, we talked earlier. Anybody want to throw out what it is? Do you know what it is? Does anybody know what it is? Okay, so coronavirus is a family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections. This has been around for a while. We have different strands of coronaviruses. The one that we're dealing with now is referred to as coronavirus disease 19, shortened up COVID-19. The clinical presentation for the coronavirus is a fever, cough, shortness of breath, and they can range from asymptomatic, so we're carrying it and we don't know that we're carrying it, a mild illness, like something similar to the common cold, to severe or fatal illness. Transmission. The source came from a live animal market, thoughts come from a live animal market in China, suggesting that animal-to-person transmission is possible. It can be spread person to person with close contact about 6 feet through respiratory droplets. Can be acquired through touching surfaces, then touching mouth, nose, or eyes. The CDC reports that the virus is spreading very easily. Those at high risk of complication include older people of all ages, or older people and people of all ages with severe underlying health conditions like heart disease, lung disease, and also diabetes. I also want to disclose that the information that I'm sharing with you is what I could pull that was most up to date. This information is changing sometimes hour by hour. So I updated some information in here just about 15 minutes ago. So as you see, the current data in the U.S., we had, as of this morning, total cases of 423, 19 deaths, and 35 states that were reporting on the coronavirus. As of 1 o'clock, when I checked again, that number had changed to 647 total cases, total deaths 25, and the jurisdictions reporting are now up to 36, including the District of Columbia. The PA COVID-19 update as of, I literally just checked it, the last update on the website was at 2 o'clock. We have 11 presumptive positive cases of COVID-19 in Pennsylvania. And the counties that are impacted are Delaware, Monroe, Montgomery is up to 8, and also Wayne. So we started off this morning, we were talking about like, how, what does this mean? Like, if somebody is coming in, traveling from another country, what do we do if we have a kid coming into our school? So I feel we have to start by defining the terms that you may hear coming into your district. So a person under investigation, there's quarantine and also isolation. And there was new new printouts that I just had over here about public health terminology. This information just came out 2 o'clock this afternoon and can be found on the web under the PA Department of Health. So the person, isolation and quarantine help protect the public by preventing exposure to people who may have a contagious disease. Persons under investigation can be a person who has traveled to an area on a level 3 health notice. Keep in mind, level 3 health notices can change. So far, it's China, Iran, Italy is also under the level 3, and there's one more that I have to look up. What did you think? South Korea. Yes. So quarantine is, oh wait, I'm sorry. Another person who is considered to be under investigation are those who have come in close contact with someone who has been diagnosed with COVID-19. Quarantine, it separates and restricts the movement of people who were exposed to a contagious disease to see if they become sick. Isolation means the person has become sick and now they're separated. It separates sick people with a contagious disease from those who are not sick. Communication on persons under investigation. What's going on now in how we're kind of getting this information, if somebody is traveling into the United States from a level 3 area, they are screened at the airport. There's a limited number of airports that the CDC is doing screening at. They are screened coming in at the airports and identified as coming in from these areas of concern. The local health departments are notified that these people are coming back to their homes, and then these individuals are followed by the Department of Health. They become a person under investigation. They are required to report to the Department of Health twice a day, taking their temperature twice a day. If through their investigation, they're under quarantine then for 14 days, if through that process, while they're checking themselves, they become symptomatic and start running a fever, they're put on isolation and may have to go through testing. So the Department of Health, if a person is under investigation, they will be contacting district superintendents to let them know if this person is an employee within their district or if it's a student. They will be contacting superintendents directly to let them know. And they, do an investigation. I want to point out this handout that I gave you guys. What is contact tracing? So employees should be reaching out to the employers to notify of statuses as well. Districts should consider how to obtain information regarding a person under investigation who are contracted through outside agencies and work with districts. And consider how to communicate the information to staff, parents, and also stakeholders. The reason I bring this up is because how many of you have nurses that work for outside agencies as an additional support in your district? Bunch, right? So when I talked to, we had this case pop up in Monroe County. I called the Department of Health last night as soon as I found out, and I, identified who I was, and I said I need to know if this person has had any contact or, has had contact within our school buildings in our catchment area. And I was told that they have to go, obviously, through the proper channels. They would identify, let the district know. And I said, well, what do you do for employees that are not employed by, the IU or the school district? How do you relay that information to those who may be affected? And they do contact tracing, which is a handout. I'll show you guys. So they'll do an investigation, and they will identify who this person has had contact with and who they have had contact with. They would do reporting to, let's say, a nursing agency, a nurse that works with an agency such as Beata would be a person under investigation. Beata would get the notification, and then it would be up to Beata to let us know if this nurse was under investigation. So for those nursing agencies that are on the call, expect a letter from the IQ advising that you should be reporting to us if there's any suspicion or if a person is being followed. So testing. This information has changed as of this morning. It doesn't necessarily mean that the processes that are in place through your family doctor or the emergency departments have changed, but PA, as of this morning or last night, was capable of testing 150 specimens per day. So throughout the entire state, we had one lab that was dedicated for testing of the coronavirus. No rapid tests are available. If you were symptomatic and your doctor suspected that you may have COVID-19, you would be sent to an emergency department or an urgent care for further testing. And that information has since updated to, they're allowing private laboratories to participate in the testing as well. So this information is likely going to change on how testing is going to be considered and carried out, because private labs are going to be available to do it. There was a news update from LabCorp, I think it was like 5:08 last night, advising that they are going to be able to participate in testing nationwide for COVID-19. If you have questions about these persons under investigation, like what do I do if I find out that a student is coming into school but their parent has returned from a business trip in Italy or any kind of place of concern, what you want to do is contact the Department of Health for further guidance. So that's the number that you can call. They can direct you to your local county Department of Health. I'll give you guys a second to write that down. No good? Okay. Some of the updates here, disaster declaration, Governor Wolf has declared it a disaster. The effect of this may be that PD has some flexibility with the 180-day minimum requirement of instructional days, and this also opens up a whole bunch more resources for us here in Pennsylvania that we'll have access to. Soon to be determined what those are, but it's exciting. So we're going to go into talking about different considerations as far as operations in your building. Since this is an ever-changing situation, things can happen very quickly. You may one day be able to go in and do your job with no problem, and the next day, well, you could be shut down due to quarantine. So human resource and business consideration. What you guys want to do is identify who's the essential staff members to keep your operations going. Determining work from home options. You can send out staff surveys to determine what is it, guys, that you do on a daily basis. Think about what you can do from home and what kind of things would prevent you from working from home, and trying to find solutions for those options. Leave requests for quarantine or family care, something to consider under HR. Tracking employees' absences and comparing to prior years. I know this may be a little bit difficult working in education because staffing, so as it is somewhat of an issue. Consider staff that fall into a high-risk category. Think of bus drivers, right? Not that they sometimes are retired, or those who may be retired and working for us part-time, or are the 60-plus population. They fall into a high-risk category, and they're likelier to be affected by the virus. Consider online self-reporting of travel plans or self-reporting of symptoms, depending on how this will progress. Something like a Google form maybe, or a survey that you can send out to your staff to say where they're potentially traveling to or where they're coming in from. Harvard had a good example on their website of how they're gaining information, and they have a department that keeps all the information confidential. They use it, and they have advised some of their staff and students that if they're traveling from these areas, to stay at home until further notice. Persons under investigation are self-quarantined by the state, as mentioned, for 14 days. You want to always, like I said before, consult the PA Department of Health when employees should return to work after a positive COVID-19 test. So far, when I've looked, there is no indication on when somebody should be coming off isolation. So, you know, what do they say? Like, if you're fever-free, right, for 24 hours, you can return to school, and you're not on medication. Is that correct?
Right.
Right. So there is no necessary guideline to follow that says when you're fever-free, you are exempt from having COVID, or you're not going to spread it anymore. So there's no evidence that necessarily suggests that yet. What I have found online is that you should always consult, you know, the Department of Health and also, or your doctor. And like I said, this could change day to day, you know, week to week. Payroll. You want to encourage direct deposit. So if somebody is picking up their check, maybe give them a direct deposit form and say, hey, consider this. Deliveries. You want to determine how shipments are going to be canceled or accepted. If school is shut down, you don't need the OJ, right? You don't want milk coming in and sitting on the docks and having to get that bill. Staffing agencies or outside supports, like building projects that you may have going on. Contracts for service. Transportation. Consider increased absences surrounding the transportation department, supports for districts, non-pub, and also technical schools. If your transportation department goes down, how many other services do you really help? If they're, you know, exposed to the virus. Food service, in-house versus outsourced. So how many of you have outsourced food services in your school district? Okay, so they fall under a whole other category, right? So there are some people that you want to reach out to and go, what are you guys doing as far as reporting? We need to know. You have somebody in food service that's sneezy, potentially, you know, came in contact with the virus. How do we want to handle that? Also talk with your outside vendors about what options they have for grab and go for children without food and how we're going to service that population of kiddos. Identify mental health supports to provide ongoing emotional support. This is considered by the World Health Organization an emergency, okay? They're teetering on pandemic. So there's likely to be, you know, increased amount of, you know, illness within families. Individuals are going to be compromised. How can we best support our students? So mental health supports. Check in with vendors on what their plans are to continue to offer support. So what are your vendor plans for staffing? What are your, if you're using, you know, a bus company, you know, to provide your transportation needs, how are they going to continue to offer support to you, and what's the plan if their operations need to shut down? Review policy and procedure regarding absences, disaster, or diseases. PSBA offers guidance on COVID-19. I mentioned that. So safety. Emergency plans. You want to identify key persons who will carry out plans and participate in development. So starting like from the, you know, the principal of the school or the superintendent of the school is going to, you know, weekly or daily or every third day send out communication to the staff on what's going on should this hit your school. You want to have a backup person in place for key roles. What do you do if an individual gets ill? How are you going to handle that? You still have to communicate to your stakeholders. Be proactive in communicating information. Have multiple platforms, to get information out to staff, stakeholders, and family. What kind of things are you guys using now? To communicate, yeah. Just, I mean, you know.
School messenger kind of thing.
School messenger, okay, yeah.
Our superintendent has put a thing on the website.
Okay, all right. So something that pops up, is it a blog that feeds out?
Well, when you come into the main website for the school,
Yeah.
you have something there for COVID-19, you can click on that.
Perfect. Okay, all right. And ensure the MOUs with local authorities are in place, including fire, police, and the planning. Understand that they have guidelines to follow concerning pandemics. They do. If you look under the PA Department of Health, there are guidelines that they have to follow, you know, in getting in contact with somebody who may have a positive, may have had COVID-19 positive. So if they're going into the home or have symptoms or have traveled, there is specific guidelines for them to follow as well. Utilizing Navigate software to execute plans, it's something, do most of your districts have that? Maybe. Okay. Share plans with county officials. We have a meeting on Friday with our county to discuss. So nursing and student health, yay, it's you guys. Monitoring absences and also tracking illness. How are you guys tracking currently? Are you tracking anything? Do you normally track, like during flu season, let's say, how do you guys track student absences to determine whether there's an increased need of intervention? Tower School? Okay.
We notice we're sending home a lot more students that we call, bosses to have to clean the building.
Gotcha.
Do big sterilization, cleaning out the building, and everything like that.
Gotcha. I heard of one school giving teachers thermometers that they could check the students when they came in every day. That's alive. I think they were a non-pub school. So consider communicating between attendance office and nurses to help with symptom monitoring. Monitoring field trips. You guys get notifications, nurses get notifications of field trips on where they're being sent out to, or if they're traveling abroad and those kinds of things. So monitoring that kind of stuff and knowing who's going on those field trips. Yeah.
Are you recommending, or is anyone recommending to not go on field trips? Because we have a trip going Monday to Philadelphia, and they're all teetering, go, not go. And I said, well, the kids, if any parent felt like it was uncomfortable, we would give them not let them go.
Right. So,
I mean, this coronavirus seems bigger than anything, but
right.
is it just like a cold?
No, this is what this is, and I can definitely take a step back and explain exactly why we're so concerned about this, okay? So you have the flu, right? And you're able to get a vaccine for the flu.
But not everybody does.
Right, correct. So there's something called herd immunity, right? So once you get the vaccine, those of us who do get the vaccine, which is the majority of the population, right?
Okay.
We help protect those who necessarily may not get the vaccine, right? So because I got my flu shot, this is just for these purposes. I may not get sick with the flu that I got the flu shot, with, and so I'm not sick, right? If I didn't get the flu shot and I ended up sneezing on you and you didn't get the flu shot because you're immune compromised or decided not to get it, now I'm infecting you. The difference with this coronavirus is that we have zero immunity to it. It's brand new. So when it hits us, the way we build immunity is by getting exposed, which is why we get vaccines. Okay, so for this, we have no exposure, it's brand new. We have no vaccine for it, which is, about 15 to 18 months per se to develop. And so it's a scary thing. And it hits your respiratory system. And this other thing that is pretty scary about it is that it presents like a cold. So, how many of you have had snotty-nosed kids come in, thank you very much, in your nurse's office, or popping over everything, or just kids that maybe, because of their medical condition, cough normally? How many of you guys have medically fragile kids in your schools that, they cough, right? So how do you determine what's a concern? You have to do some symptom monitoring, and also some kids don't always present, with a fever. So this is why this is so scary. The virus attaches to your lung cells, reproduces, and it turns into like ammonia-like. So that's why you have the shortness of breath. That's why you'll have the coughing. That's why you can't breathe. It compromises your respiratory system. I hope that answered your question.
Yeah.
So when sending kids away on field trips, there's a couple of different things that you definitely want to consider. Am I sending a kid that may be immunocompromised? Am I sending a kid into an area where there's, like right now, we're not at community contacted, it's all related to travel in Pennsylvania. There's not a case that has been identified that it comes from the community, right? Where we can't trace it back to, this person came from Italy and now they're exposed. We haven't hit that yet, okay? It could change tomorrow. That's how serious this is. So you're asking me this today and I should give you guidance. And then Friday, it could be Philadelphia's taken over because every, couple of days they're pushing out more kits to do more testing. Because right now we can only do about 150 tests in the state of Pennsylvania a day. So that may be changing by Friday, okay?
Thank you.
Absolutely. Medically fragile students. Has anybody gotten phone calls in their district? What do I do? I have a kiddo that's on a trach, a ventilator. How do I handle that? I don't want him to come to school. Parent calls up. I don't want you to come to school. That was today? Okay. All right, thank you, Jackie. So you get these phone calls coming in. I'm really concerned about my child. I am concerned about sending him to school. They're immunocompromised, they have respiratory issues, they were a preemie and now they get sick with pneumonia every year and, it's a concern, right? So, or they may not have been able to get vaccinated and let's just say coronavirus excused. Just during like flu season, if it's really bad, I've gotten those phone calls going, what do we need to do here? This kiddo, the parent doesn't want them to come to school. How do I handle this? So what we have done in the past is we've encouraged the family to go to the family doctor or the specialist and say, hey, this kid, he is compromised, he is at higher risk for severe injury or even death if he would be exposed. And the doctor would write a excusal, from school, like a medical excusal from school for a certain amount of time. And that amount of time could be revisited depending on where we are at with virus outbreaks. And then it's the determination of the education team on how they want to, if that time needs to be made up, and those types of things. Am I on point with that? Educate staff and parents on the thresholds to return to school post-illness. Like we discussed before, there's no recommendation that has come out yet from the Department of Health giving we're 24 hours fever-free. You've been diagnosed with the coronavirus, you're 24 hours fever-free, you can come back. There's no recommendations just yet. We want to contact the health department in those instances for guidance as of now. We want to educate staff on MPIs, non-pharmaceutical interventions. I read an article that has come out of South Korea, where those who were taking care of those who were positive with coronavirus, the hospital staff were using really good non-pharmaceutical interventions to take care of these people, and they didn't have a hospital-acquired infection, which was really impressive. I don't know if that's true today. This was yesterday when I read it. Today might be a different story, but I thought that was really eye-opening and powerful how much hand washing, good hand hygiene, staying appropriate feet away from people, using, not that we're suggesting using masks yet, but in the hospital setting, using their masks and isolating helps. We want to provide resources for staff and parents to educate on non-pharmaceutical interventions. So, sending out mailers, the CDC has an awesome amount of posters that you can upload to, if you have, how many of you guys use Google? We have a parent folder and also a teacher folder where we'll just update most up-to-date information to them. So posters that they can use for their classrooms, posters for families and resources for them on what are non-pharmaceutical interventions, like how long should I be washing our hands. I even saw some things like, they say sing happy birthday twice, but I saw something circulating around. I know my daughter loves the theater, so they had theater songs that you can sing that were the same amount of time to wash your hands to, which was cool. Educating about the use of face masks. They've had some districts that I've heard with, they're sending kids to school with face masks on. Has anybody had that yet? Yes.
Kids show up with them on.
How do you guys handle it in your district?
I called to make sure that the student wasn't sick.
Right.
And I just tried to educate, on the CDC that that it's more for somebody who's sick, not somebody who's healthy.
Right.
If your child is sick and needs a mask, like others, they need to be at home.
Right, absolutely. How does the parent take it?
Fine.
Good, awesome. So we're following CDC, advise of CDC recommendations. We shouldn't be wearing masks just yet. They're not recommending wearing masks when you're a well person. If you go into the doctor's office and you're exhibiting symptoms of COVID-19, you may be asked to, wear a mask to prevent those droplets from carrying. When you sneeze, it can travel up to 200 feet. And just to give you guys an idea on what that looks like, you can picture the Lincoln Memorial from one side to the other, 200 feet. That's how far a sneeze can travel. So, student considerations. If a closure occurs, how will students get to their assignments? Have you guys thought anything about that? Like online learning, I know there were some questions about applying for the online school for snow days, what to do if you didn't do that. I don't have the best answer for you. These are just considerations, and nothing has come down, I believe, as of yet from PDE on what to do. Providing an education during quarantine, sending work home, email, web-based stuff. Can children participate via virtual classrooms through Zoom or Google? Like, what if you have a kid that's home on quarantine? The IU has a pretty awesome thing where we have robots that are able to go into classrooms now and move the kid. Is that correct? Yes. Really awesome technology. But how are we gonna, get supports for those kiddos that are on quarantine at home and school's still going on? Can we utilize these platforms? We have, talk with your IT departments, obviously, about the capabilities to do that. We talked about food service. How are kiddos going to get, meals that they may have, or if you have a weekend meal program, how are you going to get that out to them? Canceling field trips, canceling large events. We've had several large events that have been canceled, and that changes every single day. Like I said, I think it's Harvard has some recommendations out there that any event that was larger than 100 people, they would discourage you from going, to those events, and that may even be scaled back now. Tomorrow's another day, whole new set of information. How can students have their IEP 504 be supported during closings or quarantines, or how are you going to make up that time with, possible related services? Communications, what sources are we pulling information from? This is a huge one. How many of you guys get, calls from parents that are pulling stuff off of, like, Facebook that is not coming from a reliable source? Yes? Anything you want to share? Nothing? Okay. All right. So, we're getting inundated with information about this, okay? And we've decided here to pull from reputable sources. So the World Health Organization, just to keep an eye on what's going on globally, and where those, hotbed areas are in the world, to know who we're kind of letting into the United States. I know there's a ban now on China and Iran, but who we're letting into the United States, that'll determine how a person, who is going to be a person under investigation. We want to follow the CDC that covers the United States, and also our local Department of Health. The CDC reported that they were reporting on these cases nationally, and now what they said was their information may not be as up to date as your local entity. So you want to refer to the state for numbers and tracing and all those kinds of things, because the CDC is in a bit of a lag time behind the state's reporting. What mediums are we using to communicate? We discussed robocalls, social media. How are you getting this information out there on updates? Should your district close? Should you have a quarantine? Should you need to close for mass cleaning? You want to discuss it all. and get that information out there. PSBA has school communication templates to use, and I can click on that in just a second. They also have a crisis communication hotline for PR guidance on what to do if just everything kind of is closed and it's like, oh my gosh, like, you know, this got way too far ahead of us before we can formulate, you know, a solid plan, like what are we going to do here? Expectations for attendance, illnesses for students and staff. We want to get those communications out there on this is what we expect, you know, if your student is ill with this, wait for guidance from the Department of Health, if they test positive for COVID-19, if a staff member is traveling in from an area and they're a person under investigation or a person in their home is under investigation, how we're going to let our staff know that they shouldn't be coming. What universal language to use. So there's a couple of different ways. Do we call it illness? Do we call it coronavirus? Do we call it COVID-19? That kind of information, because sometimes people can get, I don't know how they get confused, but they could. How to determine what information to share. Considerations for gathering information, surveys, Google Forms, those types of ways, like sending out, like I told you guys, where they can self-report on students or staff can self-report. I wanted to bring up North Shore. Are you guys familiar with North Shore? Have you heard of it? So North Shore, first, before we bring up North Shore, let me show you just what this looks like. PSBA, some of the resources that they have. Communications, the templates are available here. So they have emergency management, some legal documents, and just up-to-date news, and also over here, other resources related to the coronavirus, checklists and those kinds of things. So North Shore, did you guys get that? PSB dot, okay. So North Shore, they're an example of a school that has closed. It's out in Washington. Washington State is kind of a hotbed for this. They have moved from being able to identify where these persons under investigation have come from, and it's now considered to be community spread. So because they've had high rate of incidence and also deaths, they have decided to close the school. And the superintendent has a blog that he uses. And I just wanted to show you guys this as a resource. You guys can check it out. They have COVID-19 updates. They have examples of what they're doing as far as meal services for online learners. So they've moved things from the classroom to online. They had a superintendent's letter that went out saying if you are not able to have access to services, like if you don't have access to a computer, please click here, and done, you know, technology sharing. They have parent support sessions that they're doing online, which is great. Like I said, meal services, which is pretty awesome. Moving from classroom to the cloud, which was pretty cool. Updates on the coronavirus for their catchment area, and postponements and cancellations. So I'm just going to click on this so you guys can check it out, what this looks like. So these are those online forms that we talked about, who would need access to meals, how they're delivering them, what the pickup window is, locations that are serviced, different meal sites, which I thought was, and they're updating this, you know, daily. And they're having, you know, I think this is a really good example of what they're doing to let the community know, hey, this is where we need to go for, you know, the resources, so your kids can get what they need. Yeah, I thought it was an amazing, considering they're kind of forging ahead with this, and they seem to be the ones who are doing it first. It was pretty impressive. So how can you prepare? Things that you guys can do to help set yourselves up, and information that you can give to staff and families, is prepare your home. They have websites on the Department of Health and also CDC that provides checklists on how to plan ahead and get ready, what to do if someone is sick in the home, facts for families, how to appropriately clean and disinfect, which is really important. Check before traveling. If we have spring break coming up, depending on how this thing goes, if people still consider traveling, there's information on that. Push travel insurance. Okay. Know what to do if you become ill. So this offers a guide on what happens if you become sick. And if somebody is symptomatic and they feel like they have come in contact with the disease, what they need to do is contact the Department of Health, and they will provide guidance to them. They may send them directly to the emergency department, because right now family doctors don't have the testing capabilities in order to test on site. So they may send them to an urgent care. I know one of our area networks, if a child or an adult comes into a family health center and they say, I have these symptoms and I've been in contact with somebody, or I feel like I might have the coronavirus, they'll you know, do a quick intake, put them in an isolation room, send them off to the urgent care center. They have to call the urgent care center to let them know that the person is on their way. That person is met at the door, a mask is put on them, and they're put into a negative air isolation room, and then they're tested. So you want to reach out for the Department of Health on guidance on persons under investigations, quarantines, and isolations. You want to consult with your solicitor, and also reach out to your district physician for additional guidance. Okay? All right. So this is my contact information. You guys can feel free to write it down. Email me if you have some questions. We can also do some sharing, if you like, on best practices. I also provided you guys with what to do if you're sick with the coronavirus disease, just as a resource. I've also provided this on making decisions and risk assessment and public health management decision-making, and how they actually come to determine whether or not a person falls into a high risk, medium risk, low risk, or no identifiable risk categories. And I know it says, you know, person being evaluated from China. You can obviously use that from any level 3 persons coming in, which could be, I mean, right now it's coming from, you know, across the globe. We don't know if this could change to like state by state, if that makes sense. So we have a lot of, you know, people in Pike, Monroe County, and even down here in Northampton County that travel to other states for work, correct? Do you guys have any of that? Right. So depending on what happens in those states could definitely affect how we are classifying people when they come back in. Yeah, so that's all I have for you this afternoon. Do I have any questions? Any questions, comments, concerns? I covered everything. Awesome. Awesome. Well, I want to thank you, everybody. Yeah?
Will your handouts be available?
Yes, they are available.
So if you could just let, I don't know if folks can hear me, but if you let folks know that are streaming in, that I will share your handouts with all the PIU executive directors that they can share out if they want to stream as well.
Absolutely. So for those who didn't hear Dr. Wolfel and are participating via web, all the handouts that I handed out today, which include what to do if you're sick with the coronavirus disease. I also put in a sample checklist for pandemic influenza, which can be used for a checklist in preparing for the coronavirus as well. And the coronavirus disease risk assessment and public health managed decision-making, just so you guys have a better understanding of how decisions are made to determine a person at risk. And we also have what is contact tracing, that was a handout as well. Those will all be made available to you, and Dr. Wolf will send them out. All right. I guess that's it. I want to thank everybody for coming here today to the School and Student Safety Conference. I really appreciate it. Check out, I send correspondence all the time. We have our Nurse Consortium meeting coming up next week, where the hot topic, I'm sure, is going to be coronavirus, and I'll present on the most up-to-date information. We'll discuss best practices. And just check out the IU. There's some awesome things that we have going on. All right. I want to thank you guys for coming today. If you have any questions, I'll be available. Thanks.